Remember, Point Blank is brought to you by Vallex Lease Equip Limited. Vallex Lease affordable document management solutions. Tonight on Point Blank, my guest is Eric Ajay. He's Senior Project Manager at Lightwave e-Healthcare. Talking about Lightwave, I mean the Lightwave Health Information Management System, or LIMS. They've been in the news in recent times. The Minister of Health, Kwabena Mintan-Kano, held a press conference not too long ago. They spoke about this $100 million deal between the Ministry of Ghana government and the Lightwave Health Information Management System Limited. A number of things he said that the company disagrees. The company believes the health minister is not speaking what is supposed to be spoken. So tonight, my guest is Eric Ajay, Senior Project Manager at Lightwave e-Healthcare Limited. Hi, Eric. Good evening. Thank you very much for your time.
Good evening, Sammy.
I'll be happy if you draw a bit closer. Okay. Thank you very much for your time again.
And I thank you too for having us.
You've been in the news.
Yeah, I know.
You've been in the news in the last week or two about your whole project. First of all, what is this Lightwave project all about? Before you go into details of what the minister said and your reaction to it.
Okay. Thank you very much, Sam. And then good evening to all your listeners. Lightwave, it's an electronic medical records company. We were registered into the Ghanaian Registrar Generals of Companies in 2015. And we have a sister company in the United States of America. That is the Lightwave e-Healthcare Services, which is solely again owned by a Ghanaian. So it's 100% Ghanaian company. That's the Lightwave e-Healthcare Solutions. And we have been operating from Ghana for the past 10 years.
Okay.
So close to,
10 years. That was so 2015.
Yeah.
And you've been doing this?
We've been doing this over this period.
And this contract that the minister is talking about, when was it signed and the execution and the likes?
Yeah, the contract was actually signed in 2016.
Okay.
In April 2016. And that was the phase one. The phase one of the contract was signed in the 2016. And then we completed in 2017. That included 23 health facilities in the central region. So these health facilities range from the teaching hospital level to the CHIP compound. So we went as high as the tertiary and the lowest that we call the CHIP compounds or the health posts that we could find. After a successful completion, unfortunately, government changed and new patriotic party came on.
So you did 23 before government changed?
Before government changed, yes. And that 23, to be clear, was signed, that contract was signed by the Lightwave e-Healthcare Services. That is the United States company.
Okay.
Yes. But in 2019, when after the new government has gone through the process and has checked what we did in 2016, 2017, they approved of the process for us to continue and then increase the scope of work for us to do, which included 950 health facilities across the country. So, in brief, that's how far we have come. Yeah.
So, from 2016, 23, and then 2019, when the contract was renewed, you were given a mandate to do 950 health facilities.
950.
Give me a breakdown of these facilities.
Yes. So, these 950 health facilities includes teaching hospitals, regional and district hospitals, health centers, polyclinics, psychiatric hospitals. So all these were part of the 950. So it is not just health centers, but it has a complete coverage of the facilities that the government of Ghana runs across, including the CHAG facilities, that's the Christian Health Association facilities.
So 950, how many were you able to complete? And which ones are left before this whole press conference by the minister?
Yeah, according to the minister, we just want to stick with that figure of 450 that the minister mentions that we have completed, and it is less than half. When you are talking in terms of nominal figures, counting 950, and someone has done 450 years, any child that is able to read and write will say, oh, then it is less than half. But this is weighted. The facilities are weighted because they are not of the same size or the same how do I say? Yeah, facilities are not of the same size.
Because you can't compare a teaching hospital to a district hospital.
A district hospital, exactly, yes.
Okay. So in that one, for instance, for the teaching hospitals, the scope of work is bigger than the district hospitals.
Yeah.
So for the teaching hospital, what specifically were you supposed to do at the teaching hospitals, and what specifically were you supposed to do at the district hospitals?
Yeah. So in all the facilities, we are supposed to deploy the system, and this includes networking of the facility. In fact, even if they have existing network, we ensure that we give the strong backbone that will be able to carry the e-health architecture, because most of the facilities that were networked, some of them were using some form of electronic systems, and they didn't have a strong backbone. So we needed to put in devices that will strengthen the network that they have to be able to carry the e-health architecture. So in every facility, irrespective of the size, we created a network across the campus of the facility. And then we also provided devices, computing equipment that were supposed to run the system. And we did training at the facility level. We did in-person training at the facility level. After that, once we are done with the training, we do we are done with the training and the facility rolls on live. We do post-go live support, which is also on-site until we realize that the users are very conversant with the system before our teams leave. And then we continue to provide off-site support for the facilities. Every facility, even though have their own centralized server, every facility has its own server, which means they are autonomous. They don't depend on another facility to be working. However, if the other facility is working and they are also working and patient travel in between them, then we are able to send the patient medical records from one facility to the other for continuum of care for the patient. This architecture that we did had a centralized repository at the Ministry of Health, where we do remote backup for every facility. So out of all facilities we have deployed, every one of them have an instance at the Ministry of Health where we do remote backup. And I think about a year or two ago, Kolebu caught fire, the server room caught fire, everything got burned, and we were able to recover every data that Kolebu was on and bring them back to.
So the backup is here in Ghana, it's not anywhere else, as we are told.
It's on the first floor of the Ministry of Health. We don't store anything outside of this country. And if anyone has any evidence, single evidence of proof of Lightwave storing anything outside the country, they can bring it or use it against us. But that's why we strongly say there is no truth in what the minister put out on the floor of Parliament, and also in the accountability series that they did at the Jubilee House. Now,
let's stay away from what the minister said as far as the completion. He said 450. In your books, how many have you completed in your books?
Yeah, so we have completed more than 450.
How many? Give me a specific number in your books.
461, and there are a number of facilities that are still underway. There are about 35.
So in your books, you have done 461.
And there are 35 that we have completed networking and everything that is supposed to be done. Or we are left with supply of equipment and train the users of the facilities, these 35.
Is there a timeline? Does the contract give you a timeline to finish all these 950? You had a timeline, or there was none?
Yeah, there was a timeline, 3 years period to finish this.
And are you within the time?
No, because of some force majeure, like the COVID that came, so we weren't able to finish at the time because there was a lockdown for a very long time. So health workers, we couldn't go to do this during that time. There are times when also delays of payment, because this contract is supposed to, once we deliver the work, the government have 36 days to pay us so that we'll be able to continue on to the next phase or the next milestone. Sometimes payment delays as much as 20 months, over a year. So if this happens, then we cannot, whatever we have to support the progress of work will definitely tally, because we need to buy equipment. If it's just about training, then you can just go ahead and train, but it is not. You need to buy equipment, you need to install, you need to train people. So it's a whole lot of process. So if you have payment delaying, which is not anything that Lightwave did, but the ministry delaying payments, it will affect. We also did works that are not part of the initial engagement. Some integrations that the ministry called us to include in the process, like the e-pharmacy integration, BDR, birth and death registry, NIA, NHIA.
It was not part of the initial contract?
All these are not part of the initial contract. But in the process...
But why did you decide to do it if it wasn't part of the contract that you signed?
That's why I'm saying that the ministry requested. So those were signed agreements as part of an add-on to what we're doing, but not part of the initial contract that we signed.
With payments going to be made?
Payments going to be made, yes.
Okay, continue.
Yeah, so I've lost my line of thought, but then yes. So these facilities, I think 950, we have completed a number of them, but the ministry puts it at 450. That is fine, that's their figure. We can debate that in subsequent forums, but we don't want to now, because the reason I'm saying this is there have been, I think 2 days ago or yesterday, the PRO of the ministry, Tony Goodman, was on Joy FM and saying, oh, there are still remaining teaching hospitals we haven't done. And the producer asks, which teaching hospital? He says Sunyani Teaching Hospital. I want to ask Tony, when did Sunyani become a teaching hospital? The project was signed in 2019. At the time, Sunyani was a regional hospital. So if a year ago Sunyani becomes a teaching hospital and we have finished Sunyani 2 years ago, we finished Sunyani in 2021, how do you then say that it's now a teaching hospital? So it's a point to make that we have not finished teaching hospitals when it was, at the time of signing of the contract, was a regional hospital and we have completed it. So there seem to be some number variations that the ministry is putting out this on true. We will, if we had received a copy of the report, we would have corrected some of these things, or we would have brought some of these lies to bear to the ministry that, hey, you are mistaken. You go out there and say this, it's going to affect your reputation. But as it stands now, we have not received a single report that the audit that they did. So everything we are hearing from it is what the minister stood on the floor of parliament to say, and we had no other way or means than to release a press do a press statement on it.
The minister said your contract ended December 2024. Is that the case?
Yes, it's expired December 2024, 31st December. And before then, looking at the work that was remaining, it's just about 17% of the less than 17% actually. We wrote to the ministry for an extension, and I think that was during the election period, so they couldn't. And then government change, we wrote another letter to request for extension to complete the remaining facilities that are being mentioned in the contract.
But if your contract has ended December 2024, what is wrong with the minister bringing a new company to come and take over after the expiration of your contract then? Okay,
so this is not like building a house. When you are dealing with software, it's not like building a house. So if we said our contract has expired and at the end of the day, 2024, governments have changed and we come to 2025, are you expecting us to have just packed our things and go?
But your contract has ended.
So the question is, are we supposed to pack our things and go? If we did, like it's happening now, even now that we have reduced the staff.
It's like you renting an apartment and your date for you to leave the apartment is in or is over. You have to vacate the apartment. Is that not the same as, I'm giving a general scenario?
A general scenario, yeah. So yes, in a general scenario, yes, you are supposed to pack and go. But even when we have not packed and we decided that we don't have money to be paying all 150 plus staff that we have, and so we are reassigning our staffing to other ventures. We see what is going on. And because of the reassignment, facilities are not receiving the necessary support that they are supposed to receive. And per that, the minister sees that as somebody switching off a system, which is untrue.
That was my next question. Is it that you decide to put a system on hold, switch it
Sam,
off?
I can show you messages.
You put a whole system in your pocket and then you decide to leave it. Is that it?
For the general thing you are saying.
Because ordinarily people would think, or everybody would think, that because your contract has ended and you are leaving, you may want to sabotage the system.
So that is the part where the ministry should have, even if per this analogy, that's the part where the ministry should have even congratulated Lightwave, because we did not leave. We have continued to hold the system till now. We have continued. Governments change. It doesn't take the same period. It doesn't take 2 days or 3 weeks for a minister to be in office. There are processes for the minister to go through vetting and other stuff to get someone to start work. So like every Ghanaian company that have the Ghanaian people at heart, we decided, okay, let's give the ministry some time, at least 6 months, for them to see structure stuff and know where they want to, or where their goals and objectives are. Throughout this period, we have made a number of engagement trying to get the audience of the minister to be able to know, brief him on what the project is about, even though he knows about it as a ranking member. But now in a different office, we need to brief him. Unfortunately, we never got that audience. We never engaged him even once. And an audit was started. How would you start an audit if you have not even engaged the company? We don't have a problem with that. That is your prerogative. You don't have a problem with that. However, if you want to talk about the audit report in public, I think it is fair for you to just say, hey, this is a copy of the audit. Let's have a meeting. And then if there are any anomalies or differences, they are sorted out. And then you can now come out and say, this is what we found out. This is what we have been agreed with. We think the company is competent to continue the work, or the company cannot continue the work based on my own reasons. We don't have a problem with that. But then, for the love of the country and the Ghanaian people at heart, we continue to pay our staff for the past 9 months until the first meeting happened in September. And we actually made the ministry aware that because of non-payment, we cannot continue to hold staff to continue providing support. The minister said, okay, bring any outstanding invoices that we have, we will pay. And we submitted, and nothing. We didn't hear anything. So then we have to reassign staff. And once we reassign staff, it means we may not have enough staff to provide support for every other facility or request that comes in. In fact, we have adequately trained facilities. We have trained the regional and IT managers for all the regions. So we believe that if Lightwave is not there, these people should be able to take up the mantle and go on.
Do you want the contract to be renewed?
Yes, why not? If it's renewed, we will be very grateful to complete the work and then have a very smooth transition.
Is it not because you want the contract to be renewed? The reason why you are withdrawing your staffs to more or less, in quotes, sabotage the system, because you are doing everything to get a contract renewed.
But Sam, you told me in general we should have left. That's what you are telling me.
Yes.
And that's what the minister, per what you are saying, says that we should have done because we don't have any contract. Yes, but keeping the systems up. If we had gone, then it would be like, oh, they just left. No. So we have continued to support. We are a Ghanaian company. That's what I want you to understand. We will not close down and say we are leaving. No. We will still continue to operate. And whilst the ministry is structuring to come in, bring new policies, or minister have his own plan, we still have to continue to provide the necessary support until we know the way forward. So the first meeting we had was in September 3rd.
We are told that the whole contract sum is $100 million.
Yes, you are right.
Give us a breakdown.
Yes, so the $100 million has different milestones that we are supposed to complete.
That's why I'm seeking the breakdown.
Yes, so in this breakdown for the 100 million, we have teaching hospitals, 4 of them numbered in the contract, 4 teaching hospitals. And at the time, they were identified as the Ho Teaching Hospital, Tamale Teaching Hospital, Konfanochi Teaching Hospital, and Kolebu Teaching Hospital. There were 6 regional hospitals that were part, 243 district hospitals, metropolitan, leprosarium, which includes some of the districts have child facilities as so. And then there are 2 psychiatry hospitals. But even that, we have completed all 3. There are 3 psychiatry hospitals in Ghana. But in the contract, it even says 2.
So you dash one to government?
No, not that we dash. It is part. We can't. No, it's not a jara. We will eventually have to reassign it to any of the district hospitals. So those are details that if we had been engaged by the ministry after the audit, they would have known that this is the actual work that has been done to be on TV and radio lying or telling the untruths. There are about 49 polyclinics that were included in the contract and 646 health centers. Now, this totals up to 950. Completion of the 4 teaching hospitals alone tells us, based on the contract, we have completed 21% of the contract. Completion of the 6 regional hospitals indicates we have completed another 22%. So if we completed only these 10 facilities, we would have done 43% of the work. In that order, now the 646 health centers that was in the contract, which currently is remaining with 500. That 646 constitutes 17% of work done. So even if we had done all 646 health centers today, if we didn't do anything and the minister came to office, he would have been saying, oh, they did 68% of the work. But that constitutes only 17% of the contract. So, and when we received this, we sat down with the ministry, they said they structured it. Do the bigger hospitals, because that's where all referrals go. What will be the essence or the sense in doing smaller hospitals and then they move to a bigger facility and they are using paper and then the smaller one is using electronic? It doesn't make sense. So you do the big one so that it goes through the referral system. You do the big one, the subsequent ones. So as they are coming into the system with paper, the paper processes are being taken off right from the polyclinic through the district, regional, before you get to the teaching.
And were the hospitals using it?
Yes. And in fact, as I speak today, that the minister still says that we have shut down, we have over 200 facilities running today. I can show you evidence on my phone here. 200 plus, which includes about 113 child facilities and about 98 government facilities. Now, the misunderstanding or miscommunication that the minister puts across, and the ministry, Tony Goodman and everyone that have spoken of this, put across is that we shut down the system, which is impossible. It's rather the other way around. When the services we have completed that wasn't part of the contract, like the integrations, we told the minister, okay, so if we don't have staff and we are not being paid for these integrations, then unfortunately we can't continue to maintain, because it takes money to maintain all these. So we will close those. We will not be able to provide support for those. So that was that happened, and then facilities felt, oh, the only means by which Lightwave could reach us, because they don't have personnel on site, will be through the wide area connectivity that they have. That's the private virtual network, virtual private network. So let's disconnect them so that we'll be able to use the system without any interruption, so that if Lightwave even decides to do anything, like the minister says, if there is a way of switching off, like there's a key somewhere, then they will be exempted. Unfortunately, the system runs and checks and ensures that there is always backup going to the ministry repository. So if after running for some time, the backup doesn't go, it's a call for the system to alert the facility that, hey, your backups are not going. In that way, if it's shut down at the facility automatically, then you'll be able to reach out to the support, and then we will let you know, oh, this connectivity is down, can you establish it so that we can come in and assist. Most of them decided to remove that connectivity, and eventually they were going down one after the other. And again, even today, there are some facilities that were on yesterday that had gone off. They have taken us out. We don't have any access in going there, so how do they go out? So these are things that if the ministry had engaged us, they would have known and not come out to say the falsehood that they are propagating.
So you believe for your side, you've done a clean job, you're not sabotaging the system?
No, we cannot sabotage the system or government. The data that the system, the Lightwave Health Electronic Management System generated is owned by the government of Ghana and the Ministry of Health. We have not said anywhere that we own this data. What we own is the software, because the software for the phase 2, which is currently going on, the phase 2, is an enterprise version for 950 facilities if we had completed. So it means you don't have limited number of devices to connect. You don't have limited. You can connect as much as devices within the 950 facilities. But in the phase 1, there was a limitation. The phase 1 had a limitation of 590 facilities over the 24 months. And the phase 2 has unlimited enterprise session for any number of devices to be connected in the 950 for a period of 24 months as well.
Okay. Eric, I wish we would continue this conversation, but then time is not our best of friends at the moment. So I'm sure another time we'll invite you over for us to have go into details, of
we will be, but we just want to let Ghanaians know that we are here to help, we are here to assist, and if the opportunity is given for us to continue the work, yes, Lightwave will continue to help bring Ghanaians service that we are doing back into where we want it to be. Because in Africa, I don't think when we started there was any company or any software that was doing this.
Eric, thank you very much for your time. Eric J, Senior Project Manager at Lightwave E-Healthcare, my guest tonight on Point Blank on Eyewitness News.